Hello there, my name is Dr. Elias Mwinuka, tutorial assistant in surgery. Today I'm going to take you through wound dressing from the beginning process up to the end, from the preparation of the materials to the actual dressing itself. You should actually know what is a dirty wound or a septic wound from a clean wound. So a dirty wound contains pus and some sort of discharge. It can be accompanied by swelling, pain, and the patient can report signs of fever, chills. And so a clean wound is away from all these conditions that I've told you. So we're going to improvise home dressing by using some of the materials that we have at home. So you can come and take a look. Yes, so I'm going to take you through the instruments that we're going to be using for this actual dressing process. So we have our pair of gloves. These are clean gloves. But it should be better to use the surgical gloves when you're dealing with a very septic wound. But we are dealing with a clean wound, so these clean gloves are just enough. We have our hand sanitizer. We want to make sure that this process is as sterile as possible. So making sure that we use this at every stage of our dressing. Then we have our hospital bandage, which we're going to use to wrap up the whole things at the end. And we have a pair of scissors, which we're going to be using for preparing the gauze that are going to be used for dressing. So we're going to sterilize this by using hot water. We have our hospital gauze, which we are going to be using these bandages for the actual dressing process. And we have our normal saline and our metronidazole IV. So you can ask yourself, why do we have a normal saline? So normal saline can be alternatively used for wound dressing, especially for the clean wounds, and a mixture of metronidazole and ceftriaxone is used for combating gram-positive and gram-negative bacteria. So we also have a syringe, and an anti-pain medication. What do we use these for? Sometimes we have wounds which are very painful, which can actually interfere with the metabolic activities, such as an increase in the pulse rate, blood pressure. So we want to avoid all these complications. So it's better if your patient is covered with anti-pain medication. And we have, yes, exactly, our kettle here. So we're going to be using this for boiling our water, which we're going to be using for sterilizing most of our materials. And right here, you have our microwave. We're going to be using this for sterilization of the materials after preparing them. So we're going to sterilize our scissors with hot boiling water. So this plastic container is going to be used as a kidney dish, since we don't have a kidney dish over here. So we're going to start preparing these gauze, as you can see. So you can put on your gloves. Put on the gloves. So we're trying to make this whole process as sterile as possible. Yes, so we're going to be having these plates. These two plates that we have are going to be serving as our container. So one plate we're going to load it with the cleaning gauze, and the other one is going to be used for the packing process when you're done with the cleaning. So we're going to prepare two sets of gauze. So we have a hospital gauze here. So we are going to prepare. So you fold it up in this fashion, as you can see. Fold it. You fold it. You fold this way and this way. So you take your pair of scissors and you cut it this way, you place it. So we want to roll as many as possible, so preferably 8 and 5 to 15, depending on the size of the wound that you're dressing. So the wound that we're dressing is not as big, so we're just going to have maximum of 8 cleaning gauze. So you see, you roll them in this fashion, and the last one will do. Yes, and then you take your scissors, you cut them. So we want this wound to even look a bit better, so we can actually trim these excess parts of our gauzes, so that people don't have to actually ask you, where did you dress that wound? And then we prepare 5 more. So when you're cleaning a wound, you should get to know that you start from the surgical site itself and you clean away from the wound, avoiding repetition of the same area. So after you finish preparing, have your two sets of gauze. One will be using for packing and the other one should be used for the cleaning of the wound. So it should be to your attention that the packing gauze should be a little bit thicker but not as thick, so as to allow the circulation of air in the wound, which will also enable the healing process. And we have our actual gauze, which we're going to be using for cleaning. Remember, I told you that you start from the surgical site itself and you clean the wound away from it. So you start from the place where the wound is and you clean away. Make sure you do not go back in the same direction that you used for cleaning the wound initially. So after this, we are going for the sterilization process. So you're going to take some amount of water. You spill it here on your two containers. So we're going to use our microwave, heat it above 60 degrees, and then you actually wait for the actual results. As you can see, we keep it on high, so maximum of 2 minutes will do. So at the end, you have our gauzes, which are as sterile as possible. Then you can actually start the whole process of cleaning the wound. Remember, as I told you, we're going to be using this as our kidney dish. So here we have a mixture of our metronidazole together with our normal saline, and you have your ceftriaxone creative, a very good medium for actually cleaning the wound and actually making sure that there are no infections towards the wound. And at the end, what you're going to do, you're going to pack the wound with the same combination there, and make sure you place it properly on the wound, and then you pack it on top with the dry gauzes. These will give you extreme results in making sure that the wound is clean and also making sure that the wound heals nicely. How do you know if the wound has started healing? So you actually see signs of healing by looking at the granulation tissue being more reddish or pinkish. So these will inform you that the wound has already started to heal itself. So after preparing these instruments, then we're going to start the whole process of wound cleaning. So as you can see, we are assessing the wound. There is no swelling. As you can see, there is pink granulation tissue showing that the wound is healing quite well. So when we're cleaning, we start from the surgical site itself, and you start from here. Make your way down slowly. Do not come back up. You throw this away. You take another piece of gauze. You start from the area slowly until down. Now we are going to start cleaning away from the surgical site. So here you have this part. You start this part downwards, dispose, and you go this part downward and dispose, and you can go to the right. See, from here downwards, you can dispose it, and then this way. Yes. So from here, from our cocktail mixture of ceftriaxone, metronidazole, and normal saline, we're going to pack the wound. So we're gonna put our gauze. Make sure you pack it well, but it shouldn't be too wet. So the first part is covered with this wet gauze. So after this, we pack with even a better with the dry gauze. So put a dry gauze here on top. We have another dry gauze on top, and you finish it up like this. So we're going to plaster the wound from the down part. Yes. Plaster the wound from the down part. Make sure that the plasters are fitted in well. So after this marks the end of dressing the wound, and we keep monitoring it.